Hi, I'm Craig Deao. I've been a senior leader with Studio Group for the past decade, where we're committed to helping healthcare organizations become world-class at engaging leaders, employees, physicians, and patients and their families. In this short video, I want to share some statistics about where we are with the current state of engagement across those key stakeholders. There's lots of different surveys you could look at. My favorite on this, because it's so all-encompassing, actually comes from the Gallup organization, where every 2 years they conduct the Global State of the Workplace report. And so it's amazing to think about this. And just think about this for a second, wherever you are watching this video. What percentage of workers on the planet Earth do you think are engaged in their job? When I talk to organizations about this, I ask for a show of hands, how many think it's 100? And I've yet to find the Pollyanna that puts their hand up for that. But then I'll ask, more than 75%, and often there's 1 or 2 hands. I'll ask how many think at least half the workers on the planet Earth are engaged in their jobs, and a few more hands go up. But most audiences I talk to are stunned to find out that unfortunately it's only 13% of workers across the planet Earth being engaged in their jobs. Now, part of that might be that I predominantly speak to leaders within the United States of America, and if this is a global average of 13%, that means some countries are higher, some countries are lower. So congratulations if you're watching this as an American leader. You have the most engaged workforce in that study and many others at a 30% engagement level. And I don't know about you, but when I think about 30% of folks engaged, all I see is the pessimistic view of that 70% are not engaged in the job. And you think, how can you get anything done? Well, one way you get that done is that we know that the most engaged workers are wildly more productive than the least engaged workers. So in some regards, they're covering up all that disengagement and making it invisible to you because they're working so much harder. Of course, we know that's not sustainable, right? Because those who work that much harder, if they don't see the concomitant benefits with that harder work, either burn out, check out, or exit the organization. If we look within our own industry, there's lots of different statistics for different classifications of jobs within healthcare. This particular study from Gallup looked at physicians and found that 34% of physicians are engaged in their work, which Gallup commends as being higher than many other professions, and I think is a crisis. How can we achieve the transformational efforts ahead of us that require incredible physician engagement, intellect, innovation, if only 34% are truly engaged in their work? How engaged are patients? Now, that data is a little harder to come by. There aren't as many robust samples of patient engagement scores. In fact, even the scores themselves are engaging about how you measure patient engagement. But there was a New England Journal of Medicine article back in 2011 I thought summed up the state of engagement with patients. We know that 40% of deaths in the United States are caused by modifiable behavioral issues. We know that people with chronic diseases only take half of the medication doses that we prescribe. We know that half the patients don't follow the referral advice given to us, and that 75% of us don't keep our follow-up appointments. I remember when the phrase accountable care came out years ago, and I was talking to a physician after an evening presentation to his colleagues on the medical staff, and he said, you've talked about this notion of accountable care, and I get that we're accountable now for the end outcome of this care process, but at the end of the day, the patients have to be accountable too, don't they? And the answer is absolutely. So the question that I turn back is, and how can we facilitate and foster that? Because it's absolutely critical that we find ways to partner with patients so that they can take ownership and feel competent to do so. And what are the trend lines? Where are we heading with this? I'll tell you, when it comes to employee engagement, years ago we were heavily engaged expressly to help healthcare delivery organizations improve employee engagement and lower employee turnover. There's a clear financial case to that. If you think about the cost to replace an employee, the agency costs in the meantime, there's a clear impact on quality. There's even studies that correlate turnover rates with length of stay and mortality. And so organizations are heavily invested in this. Now in the mid-2000s, as the economy was suppressed in many markets, if you couldn't sell your house, you couldn't quit your job, turnover, I believe, was a bit artificially suppressed, and we are seeing turnover rocket back up. There are organizations we coached 10 years ago that may have had single-digit percentages of employees exiting each year that are now looking at 20 and 30, and I heard yesterday one even above 40% of employees exiting. That is a crisis. And in fact, market by market, as unemployment drops, that turnover is raging back. And if you want to proof yourself from turnover, certainly you have to be in line with things like comp and benefits, no doubt about that. You can't be out of line with it. But it's those cultural leadership things that matter. We know that employees join organizations, but often we know that when they quit, they leave bosses. Physician engagement, we believe this is a looming crisis. We've written over 30 books at Studer Group. One of our most recent was around physician burnout. I find it very difficult to think about contemplating the magnitude of change ahead of us of reducing variation in care and adhering to evidence-based practice and leading the way with innovation on both quality and cost in medicine if 52% of the physicians in the enterprise are actually burned out, sort of the other side of the coin from engagement. And with patients, it's really emerging to know what the trend line is here. But what I do know, that I find very interesting, is that while in healthcare, on the payer side, there's been more talk about engagement, it's really an emerging conversation with those of you that we work with on the provider side. But the folks who've been thinking about it a lot are the people who are moving into our industry that don't have healthcare delivery as a core competency, but have customer engagement as a core competency. And if you think about the likes of those going into retail medicine like Target and CVS and Walgreens, it'll be really interesting to think about how they approach this issue of engaging patients as they move from primary care to actually chronic disease management in some markets, knowing that they have a core competency that has amazing use of predictive analytics to know what you're going to do before you do it based on your past behaviors. They also employ behavioral economists who actually understand how to influence today purchasing behaviors, but what if in the future that core competency around engaging the customer between predictive analytics, behavioral economics, the operations of the organization could actually be applied to improving health. I think that'll be really interesting. And so we're encouraging our partners to ask some questions about how they might learn from those new market entrants. I hope this has been helpful to you, and I look forward to your work in better engaging our leaders, employees, physicians, and patients.